Hi, Rapid and Clays, and this is Patricia. In today's video, I'll be talking about pericarditis, which is one of the conditions you should definitely know before your NCLEX exam. So pericarditis is an inflammation of the pericardium. Let's know that the heart is made up of layers. We have the epicardium, myocardium, and endocardium. The pericardium surrounds the heart. The pericardium is made up of the visceral and parietal layers. The visceral layers communicate directly with the heart, and the parietal layers communicate directly with the chest. In between the visceral and parietal layers, we have the serous fluid. So this serous fluid helps in lubricating the heart. The serous fluid should not exceed 50 mL. Anytime it exceeds 50 mL, it means that it is going to cause constriction of the heart, which will reduce our cardiac output. Now, pericarditis is either acute or chronic. So acute means that it occurs suddenly, and chronic means that it has occurred over time. For the signs and symptoms, there is going to be pain in the anterior chest, which radiates to the left shoulder and neck. The pain is aggravated when patient lies in the supine position. Pain is also worsened during inspiration, and it is worsened during coughing or swallowing. There is also going to be malaise, fever, and also on auscultation, there's going to be this high-pitched scratchy sound known as the pericardial friction rub. So these are one of the key symptoms. Lab investigations are going to show an elevated WBC count, and then also when we do an electrocardiography, we are going to see an ST segment elevation. So this, together with all the signs and symptoms we stated earlier, will help us arrive at our diagnosis. Now in pericarditis, so our nursing management is going to be assessment of the pain. So the pain characteristics we described earlier on. And then also we are going to position the patient in the foulest position. We stated earlier on that when patient lies supine, it worsens their pain. So we position them in the foulest position. Aside that, we are going to administer our NSAIDs. We stated that an inflammation is ongoing, so we administer our anti-inflammatory drugs. Corticosteroids can also be administered. We can also do a culture to detect the specific causative organism and administer antibiotics accordingly. We will also administer oxygen. We can also administer antibiotics, and then we also administer diuretics. Okay, we can also administer digoxin in severe constrictive pericarditis. Also, a pericardiectomy or a pericardial window can also be done. Now, if pericarditis is untreated well, it can result in a complication known as cardiac tamponade and heart failure, which will be treated in our next video.